Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. We are continuing our series on the 8 pillars of perfect health. On our last show, we concluded part 2 of the pillar number 1, energy pathways. It took 2 shows to complete that. A lot that we covered there. This week, we'll be talking about pillar of perfect health, number 2, oxygenation. So we'll talk about O2.
Very important type of thing.
I think oxygen is important.
Yeah,
right?
I'd hate to be without it.
Okay. Well, let's just recap. These are the 8 pillars of perfect health. This is something that you've come up with after years of being involved in healthcare, especially the structure-function model that we talk about, that we practice at the Prather Wellness Center. And how did you come up with these, and why do you call them pillars of health?
Well, I got quite a bit of it from the teachers that I had and my mentors. There was a tremendous amount of input on that. But I was trying to think of ways that I could be involved or thinking about a person as they came in. And I was going through and studying that, I came up with a pattern to see exactly how I would think through someone's health and well-being. Mm-hmm. So I started out, and the first thing that I understood was that the energy was extremely important as it flows through the body. That is one of the basis of chiropractic, and chiropractors are energy doctors, and the energy flow of the body with an emphasis on the nervous system. But we have talked about the 5 different pathways, and that's what we covered the last 2 segments. Then I understood that oxygenation was extremely important to make sure that someone was fully oxygenated, which we're going to be talking about today. Xenobiotics, those are strangers to the body. Understanding those and being able to detox those are a very important part of one's health and well-being. Water, obviously we have to, have that to be able to live. Nutrition, exercise does a tremendous amount. Looking forward to that one. Mm-hmm. Rest and the Beatitudes. And
Beatitudes, what I'm looking forward to.
As I went through each of those, they are the essentials to someone's health and well-being, and you could pretty well isolate the problem of someone's, what's causing a disease, what's causing discomfort in the individual, by finding out which one of those 8 pillars are actually a problem for the individual, getting those up to par, and then introducing the health and well-being to people's lives again.
Now, you put these in a certain order for a reason, correct?
I did, and one, they're the ones that, would actually cause death the quickest. Mm-hmm. So, what is it that I need to get under control quickly? The energy flow can have an immediate effect on someone's health. Obviously, if someone's not getting enough oxygen, that's going to need to be one of my main things to actually look at. Xenobiotics, and as I go through each of these, that is the order as I look at people's health and well-being that I need to really get up to par. Mm-hmm. So as those are manifested, then we need to get those corrected. Mm-hmm. So we have a very strong way, and as I've trained different people, it becomes pretty clear on why we do that. Mm-hmm. And then it starts to make sense as you get into it. It seems a little bit of hodgepodge for someone to look at from the outside, but as you actually start doing the actual corrections, then that becomes quite evident why I take them in those order.
Are your patients aware of how you're evaluating them using these 8 pillars? As they go along, mm-hmm. We start to get them educated. First thing, the energy flow is a very easy one to educate them on because there's an immediate aspect of pain. Because we're talking about the nervous system, cerebrospinal fluid, lymphatics,
circulation, electromagnetic, and as those are blocked, then it becomes quite evident that that they cause pain, and as we get those opened up, then people have an immediate change.
I notice the radio listeners that come in are very well educated, and they've been listening to us either for a while, but they really seem to understand more than
Right.
someone.
And that's
not
why we
listening to
do
the
this radio
show.
program is education. One of the things that a doctor means is teacher. And if we can get people educated on the aspects of their health, then they start to know, when they need help, but also as they come in, they're already educated and ready to get going with the program, and they know why I'm going to be doing different things. I don't need to spend quite as much time educating them, and I always try to get my new patients to start listening to our podcasts,
Right.
that they can actually get some of the information, because it's hard to spend that amount of time with each individual.
Right, and for the listeners, they can go to thevoiceofhealthradio.com, and on the bottom of that page is our podcast they can listen to anytime. So let your family and friends know too. Well, let's go on now to pillar number 2, oxygenation. How important is oxygenation to our health? I can guess.
Yeah, stop. As I'm working on people, a lot of times people will actually hold their breath. As we're
Yes, especially when people are in pain.
or stressed, and I said, I always make a joke out of it to get my point across. I always say, I hate it when my patients stop breathing. They become bad patients at that point, and everybody laughs. But it is very true.
Yeah.
If you can actually, especially women who are going through childbirth, one of the things is if you can breathe through that, it goes much easier. It's a much less painful type of process.
I know for me that I learned the Bradley method for having our children. It was all on deep breathing.
Yes.
It was very helpful. And I take those same skills I learned in childbirth if I'm in a stressful situation or before I got my colonoscopy, I remember breathing deeply.
Sure, and understanding that one of the things is I do some martial arts, and one of the most important things is breathing. As you're going through that, if you're actually doing a sport, holding your breath is always a bad thing. So breath is extremely important on everything that you do, and being willing to breathe on a continual basis makes life much better. It increases health and well-being. And people don't realize the importance of actually taking a deep breath.
Sometimes you get razzed because people can hear you breathing at the office. Or even our children. Dad, do you have to breathe so heavy? Because you're breathing deeply.
I'm breathing deeply. And a very interesting fact is the most scientific method of actually measuring biological age and how long you're going to live is how deep you breathe. Matter of fact, it has more of an indication than genetics or any other lifestyle habit.
Wow.
So breathing is extremely important. You can do a spirometry lung function test, and from that they can actually determine your biological age because of how deep you breathe.
Is that a test? One of the tests that measure?
That is one
wow.
of the most accepted measures of biological age. And a very interesting thing about biological age is everyone should live 10 times the age of puberty. If you look at all other creatures, they all live to be 10 times the age of puberty. And we're talking about for people reaching sexual maturity between 12 and 16. So people should live to be 120, 160 years old. And as we do biological age testing, we look at death occurring around 160. So on a scientific type of a measurement, we are really falling very short. There is a huge amount of improvement that people can make in their longevity. We are very stressed. We don't eat right. We don't breathe right. And very few people actually show up as they get older, that they are usually much older breathing-wise, their oxygenation, than what their chronological age is.
Well, I know when I've done the spirometry, my biological age and growing up, I was around a lot of secondary smoke. And we're going to talk about smoking, but being around that secondary smoke, I think, really affected.
It does, especially if the mom smokes while the baby's, in womb or as the children are growing up. That will cut down on your ability to really take that deep breath, and all the different pathways that the oxygen takes to actually get to be utilized is damaged.
Well, what would happen if we were perfectly oxygenated?
Well, if you were perfectly oxygenated, one, you would live much longer, but also, if you were perfectly oxygenated, you'd look like you're 21 the rest of your life. So the lack of oxygen is really what we're talking about, the aging process. So you can actually, they've done studies on twins, one who smoked and one who didn't, and actually compare their looks and their biological age, and there's a very, very big difference. So, just cutting down on your oxygenation speeds up the aging process, and people don't live as long, people age much quicker as you cut down on that oxygenation. So if you want to look young, be healthy, then deep breathe deep.
Okay, when we come back, we'll talk about oxygenation and cancer, how smoking affects it, and cardiovascular disease. You can win a free 60-minute massage in a relaxing spa at the Prather practice. Each month, we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice.
I consider the blood work to be the blueprint to your health, and we've had several different radio programs on that and talked about how important it is to have at least a yearly complete blood test to find out where you are. The blood is the life force of the body, and it gives an amazing chemical picture of where you are with your health, and can actually pick up all the different types of diseases that could be going on. So having a thorough blood test is one of the most important things and is recommended by everyone to make sure that your health is up to where it should be and can actually pick up any type of disease process before it becomes a major factor. So having a good blood test, a good thorough blood test, is one of the most important things that you can possibly have. One of the things that I implemented when I started my practice was a blood test that could actually cover any type of problem that was actually developed that someone could actually experience. So we came up with a profile, we gave it to the labs, but they said, wow, that's a pretty good profile. Do you mind if we offer that to other people? And I said, no, that would be fine, because I feel that that's something that could be very useful. And they named it the Prather profile. So I've actually met with other doctors before and talked to them and said, "You're Dr. Prather. Are you the Prather of the Prather profile?" And I said, yeah, because, they get a list of different profiles. And so it's actually now a national profile. So we actually have 52 different lab tests that are actually included in this profile. It covers everything from A to Z. In other words, any disease process that you could possibly have in your body, that will be covered by this particular blood test. So it is something that should be done by everyone, from no matter how young you are to no matter how old you are, at least once a year, to see what your health is. If you have a problem, this will actually pick it up. And one of the nice things about that is it is actually covered by insurance. So very excellent way of actually finding out where you are, and if there are any hidden types of problems that are going on, this will actually show it up.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice. the most comprehensive wellness center in the Midwest. We are continuing our series on the 8 pillars of perfect health. This week, our focus is on pillar of perfect health number 2, oxygenation. Well, let's go ahead and talk. We've been talking about oxygenation, pillar number 2. And how does oxygenation affect cancer?
Well, it's a very interesting aspect is that cancer can't survive a very oxygenated environment. Matter of fact, they've been able to get a large amount of oxygen into cancer cells and they die. Also, cancer cells do not grow and proliferate in an oxygen-rich environment. So one of the things that is very important is to actually keep your oxygenation up. Matter of fact, people with certain types of cancer will actually have, if they are not anemic, they will have a 50% greater survival rate. So breast cancer, colon cancer, prostate cancer, being anemic, which cuts down on your oxygenation, definitely increases your chances of dying. So keeping up your oxygen on cancer is a very, very good preventative. And then also, if you can turn around someone who is having poor oxygenation to their system through anemia, difficulty breathing, blood flow, those types of things, then you can actually increase their survival rate if you can increase that. So that's one of the things that we're always looking for to work with our cancer patients or those that are trying to prevent that.
So you're saying that cancer cells can't survive in a well-oxygenated...
Yes, there's been a lot of studies on that, and that is one thing that if they, one of the things that they've done is try to figure out how they can get cancer cells oxygenated. If they do, they die.
Great. Huh.
So cancer is something that is very, very important to keep the oxygen levels that are going to the cells and the whole process on that at a high level.
Now, you brought up anemia.
Yes.
Let's talk about anemia, because sometimes we find that it's kind of, I don't know, the importance of it, or, you know what I'm trying to say?
Sure.
Kind of shoved under the rug. But what is anemia, first of all?
Well, anemia is a reduction in the red blood cells or the oxygen carrying capacity of the red blood cells. And there are several different forms of anemia that can occur. But looking at that in the patients that come in here, it's a very, very common thing that people are anemic. There are a lot of people who are more prone to it. Pregnant women actually have a 50% anemia rate. Younger gals who are starting their menstrual periods, that's a very common type of statistic. People who are older, as you look at people over 65, their rates of actually being anemic are extremely high.
Well, I have a statistic here. 10% of persons aged 65 and older have anemia.
Sure. And that's actually a very...
is that conservative?
Yeah, that's actually very conservative. Those are the people who are not just a little bit of anemic, but actually clinically. In other words, they're severely anemic. A lot of people actually, the pattern that we look at is a little bit different than the medical. When you're talking about medical evaluation of blood tests for the disease care, you're looking at cases that are really severe. When you're talking about homeostasis, we have a much more narrow type of a focus. In other words, there's quite a range for disease care, which is the normal medical model, and what we actually have is a much more narrow type of a focus to actually achieve. So when you're talking about structure function type of practice, where we base it off of homeostasis, then we actually have a much more narrow, and that number goes way up. In other words, we don't really allow for a lot of room for variation.
Right. You don't wait till they're in the reference range.
Right. We don't wait until it's a very critical disease pattern at that point. And as you do that, then you actually achieve a greater amount of health. So as we are evaluating people, many times they can have some lab tests that their medical doctor will say, well, that's okay, it's within reference range. We look at it and say, this is something that should be concerned about. We should go on ahead and treat and get that better because it will definitely improve your overall health and well-being. Mm-hmm. People will be coming into me and says, I don't want to do any more lab tests every time I go to a doctor. I've been to 4 different doctors. They've all done lab tests, and they all say I'm normal. So I ask them to let me take a look at your blood tests and let me look it over. And I find 5 or 6 things that combined are creating their symptoms from the lab test that has already occurred. And as we get those balanced into a much better range, then those people's symptoms go away. Mm. So if you're feeling tired, if you're feeling fatigued, you're not quite sure what's wrong with you, you are getting information back from your doctors that everything's fine, but you don't feel well. Well, we are much more particular about what those ranges should be, and as we get those balanced out, lo and behold, people feel much, much better. Their symptoms go away, and they start to feel like what they should be feeling like.
Mm-hmm. So you're looking at it before it becomes in that disease state, right? And,
yes.
And you made me think, too, if you're feeling fatigue, that's not normal.
That's not normal.
If it goes past, how long before someone should really get the blood work, get that checked?
Well, everybody should actually get blood work checked on a once-a-year basis. Mm-hmm. That is just a given to make sure that people are having problems. And if you have any type of unexplained types of sensations, anemia can cause headaches. It can cause fatigue. One of the very common things, I've had kids diagnosed with ADD, especially young ladies who can't concentrate, mm-hmm. and they come in and I say, well, they're anemic, and their parents go, well, yeah, we know that, they've been like that. And I said, well, do you understand that can actually cause symptoms of attention deficit? Because they can't concentrate because they're not getting oxygen to the brain, so it's very difficult to actually be able to concentrate normally.
Interesting.
If you aren't getting the oxygen, especially to a young person, when they have so many growth needs, so many different types of changes taking place, they're very susceptible to that. Mm-hmm. So I got their iron levels up to par, and all of a sudden they didn't have the symptoms of ADD. They were able to go off of their Concerta, Ritalin, whatever it might be, and could actually concentrate and function without that. Nice. So they were dealing with a symptom, but not really looking for the underlying cause. Mm-hmm. And it's amazing how many children are anemic, how many adults are anemic, and it has a huge effect for a woman who's pregnant. She should not be anemic because that's going to affect the health and well-being and the thinking power of the child.
Wow. Okay.
So there is a
Is that why they give folic acid?
Yeah, you're talking about folic acid. And the other thing about anemia, it's iron, of course, everyone's aware of that and the need, and that's something that should be measured in a very careful type of way to find out what's going on. We've had people with a lot of symptoms. We actually did some, they'd been several doctors. We did some measurements, used the ferritin levels. Had one just recently that was at a 4.5. You're under 5, you actually qualify for a transfusion, blood transfusion. Mm. So we got that level up, and it's amazing how much better they feel. Mm-hmm. Everything starts working better. You can think better. Your immune system is boosted. If you have a low iron, you don't have a normal immune system. So there's a lot of things that actually start to occur with that. Mm-hmm. There are a lot of different types of factors. You have to not just look at iron. You have B vitamins. There's not only B12, folic acid, there's B6, B1. All of those can play a role. You have to identify which one is involved. There's copper. There's a tremendous amount. Matter of fact, there's actually 36 nutritional factors that go into making you anemic. So looking those over, having a very clear picture on what those are, and the way that you achieve that is from very thorough blood tests and very few lab tests. There are very few people who actually get into the depth that it's required to find out what is that underlying cause.
Mm-hmm. And that we do a whole show on blood analysis because, you call it the blueprint to your health. It's
Yes.
the blueprint, so you know what direction to go.
And we're very thorough. One of the things that many doctors look at it, that it's actually, wow, that's so many different types of things to check on that sometimes they call it overutilization, but it's not, because it's a very cheap,
Yes.
inexpensive, very thorough, non-invasive way of finding out what the underlying cause, and it can save a tremendous amount of headache and issues later on in life.
And the reason we're talking about anemia here when we're talking about oxygenation is because of the red blood cells, right?
Yes, you
They
have to
carry
get
oxygen.
the oxygen to the cells, and the red blood cells are the carriers.
Okay. Listen to the Voice of Health Radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
I had my annual physical recently. Doctors have this power. They can open up any door and just go, get undressed, I'll be right in. Don't you wish you had that power? And they make you get undressed and sit on a table with that white deli paper underneath you. That cheap deli paper. I usually bring a little pickle. I sit next to me on the table there. Put some chips, move it around a little. They make you sit in your underwear for like 20 minutes staring at a wall. And after like 15, 20 minutes, I start feeling better. I'm sitting, I gotta get out of here. I feel all right. Let me tell you something. Before you go to the doctor, try this at home. Get in your underwear and sit on your dining room table for 20 minutes. And just put a napkin under you so you get the whole effect. Sit there. Families walking by. I'll be okay in a few minutes.
The Prather Plan weight loss program is safe, comprehensive, medically supervised, and designed just for you. Forget the trendy diets and instead start with a roadmap that actually resets your body's metabolism for optimal fat burning and increased energy. The Prather Plan has 6, 10, or 14-week programs with a proven record of success and with guaranteed weight loss. The Prather Plan is an individualized program that is tailored to your needs to create healthy new habits in your life. You'll receive support from a certified health counselor, a nutritionist, and an exercise physiologist for maximum results. Many weight loss programs can include unhealthy loss of muscle or organ weight. We target your ideal body fat percentage so you can lose body fat in a healthy way where the pounds stay off. Contact the Prather Practice today to schedule a consultation and create a healthier you. 317-848-8048 or on the web at thevoiceofhealthradio.com. The Prather Practice. Restoring hope. I'm Lisa Prather, and you're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where we get to the root cause of your health issue. We are continuing our series on the 8 pillars of perfect health. This week, our focus is on pillar of perfect health number 2, oxygenation. Let's talk about oxygenation and its effect on cardiovascular disease.
Sure. One of the things, of course, the whole purpose of the arterial system is to carry oxygen to the other parts of our body. So circulation is extremely important, and of course there's a huge emphasis on keeping the arteries open. If you cut off the circulation to the heart, everybody knows what that is. That's a heart attack. And number one leading cause of death is cardiovascular disease, and that's all about oxygenation, as you get that down. So keeping the arteries open, not only that, but also keeping the arterioles nice and flexible is a very important part of the whole oxygenation aspect. So one of the things we're very, very concerned about is that you are getting enough oxygen to your heart. The heart actually has the biggest demand for oxygen of any organ in the body. And it's a very interesting thing how the heart works. It pumps and it's responsible for getting oxygen to the whole rest of the body. But as it relaxes, that's when it actually gets its blood supply.
Okay.
So, it's forcing the oxygenation to the rest of the body, but then it has to relax to be able to get the oxygen to itself. And it doesn't actually, if there's a defect in our body, it's when it relaxes, it really doesn't get enough oxygen to itself to actually continue to function. And we get into what's called hypoxia of the heart, and that actually starts to cause a lot of the breakdown of the heart. Now, the way that the body makes up for that is aerobic exercise.
I've been thinking about that as you're talking,
Sure.
Yes, aerobic exercise, very important.
Very important, and you need they found out that you need about an hour of aerobic exercise 5 days a week to be able to keep the oxygen. A whole hour, 5 days a week, to be able to keep your oxygenation level up high enough to your heart, because as you do aerobic exercise, it increases the amount of blood that goes to the heart. Now, we're not talking about anaerobic, which is the sprinting, but the aerobic is you should be able to still breathe as you're doing the exercise.
Brisk walking.
Yeah,
running,
brisk walking. Some
cycling.
people can actually do aerobic exercise actually running. That's what they have to get up to, but they're in good shape. But yes, keeping up with the aerobic exercise. And the aerobic exercise, if you actually look at all of the cardiovascular diseases, the British Journal of Medicine shows what types of treatments help out with the cardiovascular diseases. And if you look at that, one of the first things that actually has been proven to help with almost every cardiovascular disease is aerobic exercise.
Yeah.
So if you want to have a healthy cardiovascular system, keeping the arteries opened up, keeping the heart oxygenated, all the different aspects of that, then you need to do aerobic exercise. Unfortunately, the people who actually need it the very most are the least able to do it.
Right, they're having a hard time walking.
Just going up the stairs is a difficult type of thing. So one of the things that we provide at the Prather Wellness Center is something called external counterpulsation therapy.
Okay.
And that was actually developed about 50 years ago at Harvard Medical University, and it actually provides a secondary pump to the legs. So what you do is you have an instrument that will actually, like blood pressure cuffs attached to the legs, and it'll actually squeeze the legs. The blood will go up to the heart, and you'll get about 10 times as much oxygen to the heart as you normally would. So it's like super aerobic exercise.
Well, I know they're using it with Olympic athletes also.
They're using it for Olympic athletes. Matter of fact, one of the things is the training with the ECP has really improved the long distance running. I've had several people who were very involved in long distance running, and they've read about it in all the magazines, and we've been breaking a lot of records in long distance running, and the way that they've been able to do that is through the ECP training. So it really does a tremendous amount. As a matter of fact, 7 weeks of doing that 5 hours a week, once a week for 5 days, is about the same as 5 years of marathon training.
Let me go over that.
Okay. There was a lot of numbers there.
Yeah. So it's the program, and,
Yes.
and you have the external counterpulsation, or ECP, at the Prather Wellness Center, is 1 hour treatment per day, 5 days a week for 7 weeks.
For 7 weeks. And that's what they have found is effective to get people back up to par. And it actually opens up the collateral circulation, which actually improves the whole oxygenation, because as you are...
Makes sense.
Just a normal person, about 10 to 20% of their arterial system isn't even opened up. And unless you do aerobic exercise on a regular basis, it doesn't open up. But as you open that up, then that improves the whole oxygenation of your body, lowers the blood pressure. It does a tremendous amount for the health and well-being of the system, and keeps you younger. very important for preventing heart attack. And if you do have an artery that's closed up, you have other different collateral circulation that can actually make up for that. So very, very important to be able to do that. Also, we find that it actually balloons all the arteries through the body, both large and small. So one of the very famous treatments for cardiovascular disease is they do a balloon procedure,
right,
to try to open up the arteries. Well, this does this naturally, and it does it throughout the entire system. So you improve the oxygenation of the entire body by doing that. Plus, one of the things that is very important that people don't realize is, as you're talking about circulation, there are little tiny arteries that go through the system where you actually have the oxygen exchange, and those are called arterioles. And they're actually a little bit smaller than the red blood cell. And the red blood cells actually squeeze through there and then pass through, has the oxygen exchange with the cells, and then goes back into the venous system, and then you actually recirculate that and get the oxygenation back. Mm-hmm. As we get older, a very common thing that happens is we actually have a hardening of those arterioles. And as we have a hardening of those arterioles, then we really cut down on the oxygenation. When you're talking about dementia, there's some research on Alzheimer's, that's a huge involvement with the hardening of those arterioles.
Right.
And that speeds up aging. So if you can keep a good circulation through the system, keep the heart very oxygenated so it doesn't get into hypoxia, start to break down. If you can keep those arterioles, then the brain's working well. All the different types of organs in the system are oxygenated. Keeps them young, keeps them healthy, and does a tremendous amount. Even the skin looks younger.
Yeah, and I know the ECP also helps with erectile dysfunction.
Yeah, yes, and we're
that's
talking
a whole
about
other subject.
We're talking about blood supply everywhere,
right,
which is very important. Mm-hmm. So, if as you can keep that opened up, matter of fact, one of the things that you can actually measure your arterial health is I hope this is okay to talk about, is the angle of the erection. Mm-hmm. If you can actually kind of measure how well you're doing by holding your hand straight with the middle finger kind of going out straight. And if you have a good circulatory system for a male, you're at the thumb angle. Mm-hmm. If you're decreased, then you're at the pointer finger. As you start to go down, you're at the middle finger. And as things start to get worse on circulation, then you start going down to the other fingers until you hit the little finger, and you've got cardiovascular disease by the time you hit that.
I think that's important to talk about. Because it's kind of a self-screening.
It is a very self-screening. So if you're actually having, as a male, a problem with the erection, that is a very big indicator of your cardiovascular system. So, looking at those types of things, getting that up to par, and the reversal that occurs. We've had people with hearts that were 2 times the size that they should be. After a 7-week period, the heart returned to normal size. So the heart is very excellent at being able to regenerate itself if it's given the proper blood supply to it, and you actually get it up to par. So we see some amazing types of changes that occur with that, and getting the whole oxygenation system is very, very critical to be able to do that.
Okay, and when we come back, let's talk about how other ways. We talked about the external counterpulsation therapy, ECP, that we offer at the Prather Wellness Center, aerobic exercise. We're going to talk when we come back about ways you can increase oxygenation. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. Dr. Prather, there is a device you use at your office called the electrodermal screening, or EDS. Tell us a little bit about it and why you call it the lie detector for the body.
Well, the electrodermal screening unit is a galvanic skin response unit, and it actually falls under the same category as a lie detector test or biofeedback. So it is actually, we can actually rig our electrodermal screening to actually do lie detector. But it is also a good term on that is a lie detector for the body. When you're actually, you know a whole list of different types of products that could possibly work in each type of situation, but everybody knows that not everybody responds well to penicillin. Some people actually have some very negative reactions to it, matter even to death. Some people, it's a lifesaver. Well, that's true of everything. And what the electrodermal screening does is it actually gives you a predetermination on how you're actually going to respond to any type of thing that we might prescribe to you before you actually take it, which is extremely helpful. Now, it's not a diagnostic tool. It is not classified as a diagnostic tool. But as we've gotten the approval from the federal government on the use of it, we use it purely as a means of checking to see the body's response before you would actually take something.
Okay.
So it's a response machine. Now, you have to have knowledge beforehand on what products will actually work with each type of condition.
Right.
So we're very dependent upon our lab tests and the gold standard types of diagnostic tests. But then once you've determined that, what do you do with that? Because in our instrument, we have actually 80,000 different products that we can check on.
Wow.
So with that, we can actually find out what's going to work the best for you and how you're going to respond on things before you actually take them.
And what about its effectiveness?
Through clinical studies, they have found that it's 80% accurate, over 80% accurate, which, was what actually attracted me to it, because there's not too many things that you can actually have that kind of results with.
Right. And this electrodermal screening eliminates some of the guessing.
The guesswork is the biggest thing that we're trying to get rid of.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
Don't stop believing. On to that greener, street lights.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients. We are continuing our series on the 8 pillars of perfect health. This week, our focus is on Pillar of Perfect Health number 2, oxygenation. Okay, well, we are in our last segment, and I know we have a lot to cover. Let's talk about snoring. Does that have anything to do with oxygenation?
That is. Most people who are snorers, as they actually measure their blood oxygen level, really drops during that time. Matter of fact, snoring is a good indication that you're probably low on your oxygen, because what happens oftentimes with snoring is you really try to, your body has an indication that you are low on your oxygen, and it tries to suck more in. So you start actually gasping for breath. So it leads to the sleep apnea. As you're getting into that whole process on that, then you are definitely someone who has problems with your oxygenation, and it needs to be worked on and improved. And as we can get that oxygen levels up, you don't snore at night, and we can also eliminate that whole apnea.
Or some husbands.
Some husbands too. That is a very good indicator that you have a problem and needs to be fixed. So those that are in that type of category, that's a very proven type of fact, and something that then shows that you need some type of treatment along the ways. Because the body doesn't like to be low on oxygenation, and it's going to try to do something to actually fix it.
Interesting. It just seems like a lot of people are having issues with sleep apnea.
It's a very definitely growing problem. More and more people are actually showing up as an issue. For those who have ever had to wear the machines, over the face. I mean, that really is an annoying type of thing. And though it helps with the symptoms, it doesn't get to the root problem.
Right.
You don't actually get things fixed by that means, but it's a good, standby. And basically what they're doing is providing more oxygen so that you can actually get over that. But if you can actually improve the whole pathway of the oxygenation, then you can actually see a very marked difference on that. And all of a sudden you stop snoring and you don't have to wear that nasty CPAP machine.
Right. Right. Okay, so we're talking about snoring. Let's talk about the health of the lungs and, its effect on oxygenation.
Well, for anyone who's had asthma or difficulties with their lungs and they're gasping for breath, they know how uncomfortable that can be. But keeping the lung health up to par is a very important aspect. And measuring it through a spirometry test is one of the important ways. And, of course, the medical profession is looking at a disease state. What we're looking at is even further than that, getting the maximum out of your lungs. Because you, have to be able to take a deep breath, and you need to take a deep breath to get the oxygen down into the lungs. But then you're transporting it through the bronchi, bronchioles, and then down into the alveoli, and then you have the transfer of the oxygen into the circulatory system. But if the lungs are not working right, if they have poor nutrition, if they have a poor inflation of the alveoli, there are definite things that are necessary to get that up to par. So evaluating that, looking at that, and there are many different types of nutritional products that help with that. There are many different exercises that can be done to actually improve that. So looking at that, evaluating is another important part of what we do at the Prather Wellness Center, because we're looking at this as a complete type of a process. One, are you breathing deep? Are you getting the oxygen into the lungs? First off, then is the lungs actually transporting the oxygen into the circulatory system? Is the circulatory system open? Is it able to carry the red blood cells to the cells? Is there a transfer at the arterial level? Then you also are talking about the respiration of the cells, which is a whole nother process that is very much involved to be able to utilize it. You're talking about mitochondria and all sorts of different types of chemical reactions, which I won't bore on, which you have already told me. Don't bore people with all the chemistry of that.
Bore, because some people you wouldn't be boring, but yeah, we don't need to go on the Krebs cycle.
But evaluating that and looking at that, because we can actually do lab tests which will specifically show how that is working and if there's a failure on that.
Yeah, let's talk about the testing you use at the Prather Wellness Center to check for oxygen levels.
Well, first off, of course, is just a SpO2 measurement, which is a pulse oximeter. Actually measures the oxygenation in the circulatory system, how high it is, very important. We test out the lungs in several different ways. To see exactly how they are working. We have a unit called a CardioSess, which is actually unique. I think I'm the only one in the Midwest who has one of these.
It's called CardioSess.
CardioSess, and what it does is it actually measures how much oxygen is getting into the heart itself and the exchange of the oxygen and carbon dioxide. It also shows up the ability of the heart to actually handle stress and what types of things are going to be needed to actually fix that. Then we can actually remeasure it and see how the progress is actually making. It's probably the biggest indicator of cardiovascular disease that we have. We also measure with Dopplers. We see exactly how the blood flow is going through the body. We look at blood tests. We get into very specific types of blood tests to actually see what's going on, what's actually causing the anemia, what is the problem with the whole respiratory system of the cells. Keeping that up, being able to manufacture the mitochondria, what's the level of the mitochondria in the cells. So all those things are important to be able to look at to get a total picture of the oxygenation of the cells. If you don't test, you don't know. Right. You don't know where the breakdown is. And anyone who has a lowered oxygenation through any of those different types of ways, whether their lungs aren't working, the circulatory system isn't working, there is a poor exchange of the oxygen and carbon dioxide. If there is a problem at the cellular level, the fatigue, the disease that actually comes from all those things. And we're talking about two of the most major killers out there, cardiovascular disease and cancer. Then, this starts to bring that home. And everybody wants to look younger.
Right. And feel
live
younger.
longer, feel younger.
Yeah, live longer and feel good.
Sure, the aging process. What is it that people, as they get older, I'm tired, I don't feel good, and all of a sudden, if they got a huge blast of oxygen to all their cells that they have been missing all this time, all of a sudden they feel young again.
Yeah, I'm going to take a shout out to my dad. We're going to be celebrating his 77th birthday, and I'm just, so proud. We vacationed with them. In Italy last year. We couldn't keep up with him and his wife, practically. That's just because when we vacation, we
like to slow down.
Yeah, we like to slow down. They're retired. They're always slow. They're vacationing when they're not traveling. But, I think about his activity level. I mean, he stays active. He moves. He cycles. He bikes.
Sure.
In fact, he fell off his bike a year ago, but he had no broken bones, nothing. And that's health. As you're growing older, you continue to move, and it's so important.
Sure, if you can remain oxygenated when you're in your 90s, living into your 90s is a great thing. You feel good. Mm-hmm. You're still able to enjoy things. People are always saying, well, I don't think I want to live that long. Well, they're thinking about people who are crippled. Mm-hmm. And you don't have to be. You don't have to age like that.
So if someone's listening in their 60s or even their 70s, is it too late?
No, most of these things can be reversed. There is a tremendous amount of regenerative ability in the body. Mm-hmm. The heart has an incredible regeneration process. Mm-hmm. The arteries, you can actually grow more arteries.
You were talking about the collateral arteries that aren't even open, 10% of them?
Well, 10% of
open.
Anywhere between 10 and 20%. Oftentimes people have about a 15% amount of arteries, but then you can actually, through the ECP exercise, actually start some hormones that actually stimulate arterial growth. Mm-hmm. So you can actually get even more circulation than you had before.
So someone that's out there listening and is having a hard time moving and wants the oxygenation, something like the ECP would be very good for them.
It's excellent. One of the things that has been a question for people on the ECP is, well, if I just do the ECP and I don't exercise anymore, do I lose everything? And actually, the answer is no. Mm-hmm. The collateral circulation is already opened up. We actually have tested people 3-5 years after the ECP. Now, we always encourage people to be able to get out there and exercise, do the aerobic exercise. But, of course, a lot of people got into that issue because they didn't do aerobic exercise.
Right.
And oftentimes we can't make them do it, even though we encourage them to.
Right. We all have a choice.
But when we actually tested them, even 3 years afterwards, there was actually a gain from even when we had quit the ECP. Because the ECP stimulated a healing process that continued even after they had quit it. Wow. Because there was even more arterial growth that was taking place. The changes that had occurred were pretty much permanent. Mm-hmm. So, we've had people who... I had a Amish gentleman who came in, and they were saying that really he didn't have too much longer to live because of his heart. He had type 2 diabetes. He was overweight, and we started him. He couldn't exercise, didn't feel good, hard to even think about eating right.
And he was someone that needed to chop wood and...
Well, that was what he was used to doing. Mm-hmm. And we did the ECP, and we were going along with everything. And he if you've ever dealt with the Amish, they're they don't give compliments very easily. Mm-hmm. And he was like, I don't know. I think I'm better, because we were testing him out and things were actually checking out pretty nicely. And I said, well, he said, but I have to say I went out there and chopped a truckload of kindling wood, and I haven't done that in 10 years. And I said, well, that's actually pretty good. And so if you want to be able to get out there and chop kindling wood again, and you haven't been able to, then that's actually a really positive thing. Mm-hmm. But we've seen people who stopped snoring, as we started on that. Their sex life came back. Mm-hmm. There was just a huge change that took place in their life and well-being. And the changes continued. Again, we probably got about 30% of the people to start a regular exercise program, which we recommend. Uh-huh. But quite frankly, not everybody did. And, you can't make people do something that they don't want to do.
Right. Well, thank you, Dr. Prather. As always, we're out of time.
Darn, I got even more to talk about.
All right, but next week we're going to talk about pillar number 3. Got to keep moving on xenobiotics, poisons in our bodies, so it should be very interesting. The Prather practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather.